lot of treatment decisions are dependent on genetic testing. It's especially true for breast cancer patients when we have to decide whether they will go for one type of surgery compared to mastectomies. And these decisions needs to be done fast. Patients are already dealing with a difficult diagnosis. They do not want to wait for many weeks or months.
Coming from a perspective of living in Yuma, I think one of the hardest things that I've seen for our patients is when they end up here or have been being treated out of town and have done all this travel only to find out that we have all of the services they need here. So I really think that, especially with genetic testing, which is a really good thing for patients, if they don't have that because they can't travel, then they always have to wonder. Or they have to travel when they're already sick and stressed.
So it was really important for us to bring genetic screening and counseling to Yuma because we're a really small, rural, medically underserved community. Thankfully, we met with Myriad Genetics, a genetics testing laboratory, who presented us with a new service. Through Myriad, we're able to connect our patients with a certified genetic counselor via tele-education, via telephone, right here in our clinic. They don't have to travel anywhere, and it's all part of their services. It's all included in what they provide, so at no additional charge to the patients.
I decided to have the genetic testing done just for the simple reason it was just such peace of mind. It was such a relief that, you know, the rest of the women in my family weren't going to have to worry so much about that. It's not going to have to be something that they were just dreading and waiting for. So it was a big relief. It was such a confusing time. It was so chaotic that it was nice to just be able to be home and get that done and not have to travel.
This process has broken barriers on so many fronts, you know, from financial barriers that our patient population experiences to cultural barriers. You know, a lot of our patients are Hispanic. They have trouble with English. Some don't read. Many of our patients are elderly.
So having those facilities available within our community has immensely helped them and our surgeons in facilitating the cancer surgeries faster for them.
8 months prior to initiating the process, we had only tested 24 patients. Only 24 patients had undergone genetic testing. In the 4 months after we implemented the process, we had quadrupled that number.
The big thing that we're dealing with now, of course, that we're offering it, is that they want their family members to be able to be tested here too. So I know that we're hoping to bring that to Yuma eventually as well.